Does your blood pressure go sky high when you get to the doctor's office, but it's normal everywhere else? If that's the case, you might have something called white coat hypertension. It's when you see the white coat, whether it's on a doctor or a PA or a nurse or whomever's checking your blood pressure, you develop a transient hypertension or high blood pressure. Now, why is that happening? I mean, it could be because of a number of things. We usually think it's because of anxiety or nerves or maybe a little bit of jitters or anticipation. You know, many of my patients actually worry when they come to the doctor. They worry about test results. They worry about all sorts of things, even, blood pressure. So that's what white coat hypertension is. And generally, your blood pressure is normal elsewhere. If this is you, you're not alone, because studies estimate that 15 to 30% of people who have high blood pressure in the office have this white coat hypertension where it's high there, but it's not high anywhere else. But there are a few things we should do if that is you. So first thing I say is, and this is me as your friendly family doctor, this is what I do with my patients. In fact, I am in my own office right now. See, this is actually my office, one of the exam rooms I use. So there's a couple things that we need to do. First of all, it's important to remember that some studies have suggested that people with white coat hypertension may have an increased risk for developing cardiovascular disease or sustained hypertension or sustained blood pressure, high blood pressure in the future. So what's really important is that we understand if your blood pressure is high really only at the doctor's office or if it's possibly high in other places. So one of the things I recommend is home blood pressure measurements. I want to know what your blood pressure is when you're home, when you're not sitting in front of me totally nervous and freaked out maybe, when you're home, when you're relaxed, when you're in your home environment. You want to make sure though that your home blood pressure cuff has been calibrated or checked with your doctor's office cuff to make sure that your home cuff reads normally, because there's a lot of them that read high. By the way, I did a video on this. I'll put the link in the description so you can see things that you should check out when looking for home blood pressure cuffs to try to make sure they're as accurate as possible. So that's the first thing. Now there's also something called ambulatory blood pressure monitoring. That's right. That's where you actually wear a monitor to check what your blood pressure is for a period of time when you're outside of the office. And I think this can be super helpful because, again, we want to know, are you just high when you see the white coat, aka white coat hypertension, or is your blood pressure high in other places? And then the last thing I'll tell my patients to do is to get your blood pressure checked when you're in other places. Like if you go to a specialist office, to maybe obviously your cardiologist will do it, but if you're at a dermatologist's office or endocrinologist, or if you're at urgent care for something, maybe even if you're at a CVS or a Walmart or whatever, and they have someone who can check your blood pressure, have someone else do it in a different place. For those healthcare workers, I say, hey, if you're a nurse or a PA or a doctor, have one of your colleagues or friends check your blood pressure at work with one of the blow up cuffs so we can get different readings in different places to be able to compare. That's super important. But aside from that, a few tips, guys, for you guys when you're coming into the doctor's office. I don't want you to be nervous of my white coat. I don't want you to be freaked out and scared and whatever. I always tell my patients, I'm not going to hurt you. What are you afraid of? But of course, it's more than just that. And I realize that. I recognize that. A couple things you can do is to try some relaxation techniques before you get to the office. That is right. In addition to making sure that you are relaxed when you come into the office, that you have plenty of extra time, you're not running late, you're sort of relaxed, maybe sit in the car for a few extra minutes and sort of take some deep breaths, do some relaxation, some meditation before you come into the office to get your mindset and your mind right. The other thing you can do is pick a time of day that's going to be best for you to come to the doctor. If the doctor's office makes you nervous, and by the way, it makes a lot of people nervous, pick a time of day that is least stressful for you. Maybe that's first thing in the morning. Maybe that's Saturday office hours. I actually see patients on Saturdays, and to be honest with you, that's like the most peaceful day I ever see patients because it's quiet and no one else is in the office but me and my staff. So pick the time of day. Maybe it's in the evening, whatever works best for you. That's going to be important. And I would also say if your doctor allows you to do this, sometimes with patients that I know have white coat hypertension, I'll let them sit in the room for a little while. I'll come in and say hi and I'll do my little stuff, but I'll step out and maybe even go see another patient and come back to allow them to sit here for a few minutes, sort of uninterrupted. They can read or whatever, scroll on their phone just to relax, and I recheck their blood pressure. So guys, those are a few things that I hope will help you, especially if you have white coat hypertension or think that you might. Of course, it's important to get this diagnosed definitively because you want to know. And of course, we do think those with white coat hypertension might be at risk for cardiovascular disease and sustained hypertension. So you want to know what the deal is. Guys, I hope this is helpful. Make sure, as always, that you're talking to your doctor about your health. They are your number one people. Guys, I'm Dr. Jen Caudle. If you've not subscribed to my channel and clicked the little bell for updates, I invite you to do so.